I am Dr. Marta Tejedor, transplant hepatologist at the University of Iowa. Today, I want to discuss with you what fatty deposition can cause to the liver and how that liver disease might progress. Can it progress to cirrhosis? So, when fat deposits in the liver, and the main reasons why fat might be deposit in the liver are, on the one hand side, alcohol intake, but on the other hand, what we call cardiometabolic risk factors, mainly diabetes, obesity, but also high blood pressure and high cholesterol. Any of those two sets of risk factors will cause some fat deposition in the liver. That fat infiltration of the liver is what we call steatosis. That is the earliest stage. And at that point, there is nothing other than fat in the liver. But that fat will cause some degree of inflammation. And when that inflammation starts happening, then your liver numbers will start to increase. That is what we call steatohepatitis. It just means inflammation of the liver secondary to fat infiltration. And that inflammation will resolve, but then it will become inflamed again, and it will resolve. And if you think of this process as if you always scratch yourself in the same place, you scratch, it heals, you scratch, it heals, you scratch, it heals, eventually you'll get a scar. So the same thing happens in the liver. That repeat process of inflammation and resolution will cause progressive scarring in the liver. The degree of scarring can be measured in a ladder type score, where the lowest step is what we call F0, where there's no fibrosis whatsoever, and F4 is the highest step in the ladder, where there is so much fibrosis, where there's so much scarring, that we call it cirrhosis. Cirrhosis is just a fancy term to say that the liver is very scarred. When the liver becomes progressively more scarred, it goes from being something soft like a sponge to being something hard like a rock. Once we reach the advanced stages of cirrhosis, we start to see some consequences of that scarring, like building fluid in your tummy, developing abnormal vessels in the esophagus, or becoming confused, like with a brain fog. Those are the complications of cirrhosis, but they're only seen at very advanced stages of liver disease. Usually, until we get there, we are completely asymptomatic, and that's why it's important to check with your liver provider or with your primary care provider to make sure that your liver is healthy.